WHO has been a veritable partner, in fact, the most important partner we have in the health sector.
All of the success we've achieved in the polio eradication initiative in Nigeria would not have been possible without WHO.
Tens of thousands of WHO vaccinators and surveillance officers helped to ensure that all children in Nigeria were immunized and protected against the wild polio virus.
WHO is the lead for surveillance. Without WHO here, surveillance activities will not be carried out as they should. Without WHO here, vaccination, especially for Borno, where innovative strategies are required because of the emergency situation, the conflict, the leadership of WHO to ensuring that strategies are modified based on the circumstances on ground.
We in WHO Polio Lab, we have already been trained on how to use PCR facilities for diagnosis of polio. So it was just like a small push. So we were able to respond to COVID effectively using the machines supplied by WHO, using the staff of WHO Polio Laboratory, using the infrastructure meant for Polio Lab.
WHO has been supporting the government and the people of Borno as well as Nigeria in general. We have benefited so much.
If there is any program within our community, or the first organization that will come to us is WHO.
There's one particular aspect of WHO which I appreciated not only here in Maiduguri but globally, that particular aspect of readiness, providing that particular readiness of peak time response at any particular moment when certain innovations or certain interventions or campaign is happening. You will see that the forefront runners, WHO is in the forefront.
Recent emergence of circulating vaccine-derived polio in Nigeria has been a cause of concern. But with WHO's quick intervention and rapid deployment of polio officers to the affected regions, along with technical support provided to the government, a full disease outbreak was averted.
The outbreak was coming from those areas that were hitherto cut off from the state by the insurgents. So a lot of work and strategy went into trying to see that all the children in those areas were vaccinated. Some specimens were taken from those areas, being analyzed, and reports being disseminated.
WHO came back to actually increase and surge that capacity support, trying to sort of build back on the strength that we have pre-certification. And it has been swept.
The government surveillance data being supported by the WHO now points to an increase in surveillance as cases decrease.
The response has been not just timely, I would say usually less than 24 hours. We have all the information we want. We have them working with us. Technical experts do come in as the need arises, even from outside Nigeria. So they are a veritable partner in public health response.